my name is Camila Consolmagno. I'm Results UK's Parliamentary Advocacy Officer for Child Health, and I was here co-leading this delegation to Kenya. The purpose of this visit was to showcase UK-funded projects in Kenya, so relating to global health, so TB, child health, and nutrition.
And what are the existing gaps that exist in terms of the fight against TB and also in terms of nutrition in Kenya?
So one of the things that I noticed across the board was the fact that lots of things are actually still handwritten. So digitalization, or the lack thereof, is one of the biggest cause for concerns because of the amount of man hours it takes to actually check records, write records, and all those things. Another thing I would say is lack of capacity. So we see that the services are great and the people working are there every day fighting the fight, but there's not enough beds, there's not enough x-ray machines, there's just not enough facilities and staff. So that's definitely one of the things that we'll take back home.
What has the UK been able to do to reduce the number of tuberculosis cases and also to improve the nutrition, especially nutrition among children?
They've done brilliantly. So they've taken the money and built facilities with the right care, because they know exactly the steps to take to tackle malnutrition and TB. So for example, for malnutrition, if a child comes in and they're underweight, they begin the session to tackle that, but they're also screened for TB, and it's just incredible the connection between all the sectors and the communication between TB, nutrition and child health is brilliant and unlike anything I've ever seen anywhere else.
Why is it important to improve nutrition among children in terms of the society? What does malnutrition, how does it impact the society?
Children are the future. If they're malnourished, if they're weak, if they're not growing properly, and when it's fatal, it impacts society a lot. It means loss in economy, loss of ability to work, loss of ability to learn, and they don't put back into the society that they grew up in, which means it delays development for that society. So it's just really, really important to tackle these issues so children grow up healthy and become valuable members of society.
What are the key highlights for you during this visit?
The key highlight for me is definitely the people. The people I've met here have been invaluable, just so friendly, so warm, and unlike any other person I've met before. The Kenyans are just so incredibly welcoming. Second to that would be visiting the facilities themselves. So it was the first time that I got to see my work showcased, and just seeing it firsthand. And yeah, I would say those two, the people and actually visiting the facilities. It's been such a pleasure to be here and to be received by Kanko. They have been invaluable to our delegation, our trip, and our work.
How does funding help to improve the healthcare system in less developed countries?
So in less developed countries, they receive less from tax, for example. So international funding really helps fill in the gaps where the domestic resource mobilization can't do it by itself. So it's just very important that not only we continue sending money to Kenya, but that it's increased where it needs to be.
So the CSOs, what is their role, or do they play any role in the healthcare and nutrition of a country and in improving the status of that?
Absolutely, absolutely. CSOs are invaluable to that. We advocate for the countries that perhaps need funding and don't have a direct connection to the government back home. So because we have a very good network of UK parliamentarians and we know who's interested in what, it really facilitates the connection of the voices there, because we don't want to act as the voice for developed nations, but rather just lift up the existing voices and make sure that they are connected. So it's invaluable. I would argue that the media back home hasn't done much to increase sensitization. I would argue that we still have a lot of steps to take before the British public is very well aware of exactly what's happening within the international development sphere. So what I would say is we have work to do.
What can the media do?
The media can begin by bringing awareness to exactly how UK funding plays a role in the development of developing nations such as Kenya. I think one of the things is that the British public, with the cost of living crisis ever since Brexit, ever since the pandemic, we've actually faced a little bit of a burden ourselves. So when money is then being taken out of the country, people are like, why? We don't understand, we need it actually back here. So it's really just about building that awareness, building that knowledge, and making sure that they're accurate in their reporting as well, that they don't victimize developing nations either, but just make it very clear why the money is being sent.